Good morning. Are we sure it's on, or am I just loud? Okay, good. Good morning. Thank you for coming this morning. My mom is a retired nurse, so I grew up with not only washing your hands all the time, but I know how to wash my hands. I learned how to cover my cough, and actually now, coughing to the elbow. And I also learned that to wear a seatbelt, because my mother said we never want your face looking like a road map when you go through the windshield. But in the last few days, people have been asking me, what is Carroll County's plan? And I know these great preventive measures that we're talking about, it's on the news, it's on Facebook. Thank you to the school systems for sending things out to us parents. But I thought about those that aren't parents and don't have kids in the school system. How are we supposed to know what to do? So I'm thankful that Dr. Larson and Tim Pageant are here today, among others, to share with us what is our county plan, what does a family need to have to be prepared, and what is the best way to be prepared. So I'm going to turn it over now to Gary Thomas to lead us in our invocation, and Chief Bearden is going to lead us in the Pledge of Allegiance.
Let's pray. Our most gracious and loving Heavenly Father, we thank you for this day. I thank you for the group that's gathered here today, dear God. I thank you for each entity and agency that they represent. I ask your hedge of protection upon them. Be with them and their families each and every day, dear God. Be with our meeting today as we plan for this virus, dear God. You're a God of healing, and we ask that you would be with us as we work to protect our community, as we work to protect our relationships and to work together for the better good of this community. Be with us now as we plan. Watch over and care for us each and every day. All these things we ask in your Son's precious and holy name. Amen.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Good morning. Well, we look as some of y'all got emails early this morning. We're looking at this meeting today. You got an email about the weather. When we go to classes and stuff, we a lot of times train for the worst and hope and pray for the best. And so today's one of those days, but we got to be ready just in case it happens. I want to talk a little bit about a history of a pan flu committee that was set up in 2006. This is nothing that has, this is something that we've addressed before. We're updating that plan now, and we'll be sending out updates to that. And it pretty much involves everybody in this room. As y'all know, what we normally do is we do the all-hazard planning. We plan with everyone because we never know what's going to happen. Public health, it kind of takes the lead in this. We're very fortunate to have Dr. Larson, who is local here, who is an expert in it. So that's the reason we asked her to speak today. And if we don't plan, we fail. So that's the reason that we're planning. Just a couple of things that we do want y'all to realize is talking a little bit about the Pan Flu Committee. We'll have some more meetings and stuff like that and decide how we want to go forward with that. But we've got a pretty good plan in place already. We've just got to get it updated with current names and current locations and things like that because things change. If y'all remember, we've had the bird flu, we've had the swine flu, we've had Ebola. In Carroll County, unfortunately, we've had meningitis outbreaks. We had crypto. So this county has had our share of disasters, but we have to prepare for all of those disasters, and we have to be ready. And it takes everybody in this room. Just real quick, there has been some questions about planning for you at home and planning for the future and being prepared to stay at home. We encourage everyone to have a 7-day supply of stuff at home. That's not crying the blues or anything. You need to have that for disasters anyhow, especially with the power outages that we may have or whatever. You need to be prepared for 7 days. That's everything from medicines to food to fuel in your tanks of your car to water, also to have a little cash. I mean, I hate to tell you, but if something happened, everything went crazy, we'd want that too. So, not that we think it's going to, but as we always do, we plan for the worst and we hope and pray for the best. So, keep that in mind. We're going to put some things on our website. We're going to put some things on our Facebook page telling people what to plan for. We've got an excellent book that the Sheriff's Office assisted us with several years ago in being prepared, and it gives you some very good tips, and we'll put tips from that on our Facebook and on our website. So without any further, I'd like to turn it over to Dr. Laura Larson. Dr. Larson, as many of you know, is the infectious control officer for Tanner, but she's also chairman of the Carroll County Board of Health. Dr. Larson.
The first thing I want to tell you guys is that everything I'm telling you today may change tomorrow. That's the thing that's kind of impressive about a pandemic and the information that we have right now, is it's quickly evolving and quickly changing. So the guidance that we're getting, I'm going to give you a medical overall on where we have come to get to the point that we're at now. But the information that I tell you today may not be valid going forward. So I've had a lot of questions about coronavirus and how this is, we've never seen a coronavirus before. That's actually not true. Coronaviruses have been with us for years and years. They just usually don't cause severe disease. They usually cause something as mild as a cold. We've had coronaviruses that have been bad for us in the past. SARS was the first one that happened to us in 2003. And then MERS, and SARS, is the one that we saw first, then MERS is the Middle Eastern respiratory virus. They called this one SARS-2, or SARS-CoV-2, because it causes this severe acute respiratory syndrome. And it was changed to COVID-19 to be a little bit easier to understand, and that it's coronavirus disease 2019, because that's when we started seeing the cases in China. We think that this virus originated in a bat. We actually have most of the coronaviruses do jump from animals to humans. We think that's what the reservoir was for this one. And initially, when we started seeing cases of severe pneumonia in people in China, they were exposed to a seafood market. And that was the thing that tied all of those patients together. And then they started seeing that, hey, we have patients now that weren't associated with a seafood market. And that's how health care workers and investigators knew that we were seeing community spread. And that's what made this virus unique, what made SARS unique and MERS unique and different from other things. And novel just means new. It's a new virus that has ongoing transmission, and that's what makes it worse, and that's what makes it special, and that's what causes it to potentially be a pandemic. So it spreads from person to person. Usually people within close contact to one another. The magic number right now is 6 feet of contact, and it passes through respiratory droplets. But you can also get it by touching a contaminated surface and then touching your mucous membranes. So this happened with SARS. One of the big mistakes we made with SARS is everybody wore masks, but no one washed their hands. And so people were still getting transmission of disease. You get it through respiratory, but also contact with your hands, because your hands in particular, if you touch your face. That was like the hardest thing I learned in infectious diseases training, was not touching my face. And that's a very hard thing to do when you're taking care of patients. We know we have symptomatic spread. We know we have asymptomatic spread. And what I mean is that patients are contagious before they're sick. We don't know what that length of time is. There have been reports across the board on that, but we really don't know. It seems to be spreading easily and sustainably, and the incubation time from the time you get exposed to getting disease is about 5 days, but it can be anywhere from 2 to 14 days. So if you look at, this was the initial symptom chart that came out from CDC, and I like it. It's outdated now because we don't have, if you've been to China in the past 2 weeks, now it's more countries obviously than that. But the symptoms that we worry about the most are the top 3: fever, cough, and shortness of breath. Because there's a myriad of symptoms you can see with people that are infected, but these are the 3 top symptoms that we worry about. So that's why I like that poster. It brings it down to just those 3: fever, cough, shortness of breath. And you'll see that in layman's terms, they'll put fever, cough, difficulty breathing too. So for clinical management and treatment, the good news is what we're seeing so far is about 75 to 80% of the cases we think are not going to require hospitalization and are really going to be mild disease. But up to 20% of the cases may require hospitalization and may be severe. The at-risk populations are older patients and people with chronic medical conditions. A lot of people ask me what those are. It's lung disease, cancer, heart failure, and we say cerebrovascular disease, that's broad, but people with depressed mental status have a harder time clearing respiratory secretions, kidney disease, liver disease, diabetes, immunocompromise, and pregnancy. And I can't really understate that more because pregnancy, especially with respiratory diseases, has been a high-risk group for us. One of the things that's good that we know about so far is that children seem to be not affected more than anyone else. They do not appear to be a high-risk group. So there's no current treatment available. There are experimental treatments. We don't have a lot of data on them. And I understand that those treatments are really reserved for those patients that are severely ill that have CDC and state involvement. The fatality rate is all over the place, and I don't want you to hold me hard to this 1.4 number. That's the number that I pulled out of the World Health Organization information yesterday. I'm seeing death rates anywhere from 0.7%, and you'll see initially the reports out of China were up to 4%. So people ask me all the time, how does that compare to flu? The fatality rate for flu is 0.1% for most seasons. So we are seeing this disease, at least now, being more fatal, and some quotes are saying 10 times more fatal than flu. We don't know that for certain, though, because we know there are a lot of mild cases that weren't necessarily picked up, so we don't know if our numbers are right. So that's, I want to say that with an abundance of caution, that while we do think that the fatality is higher, we don't know how much higher than flu it is. So prevention is really something that, since we don't have treatment, this is what we're going to have to be good at. And I really do think we are good at this as a general rule. And for me, you know, I'm counseling my niece at Georgia, my children at school, people that are traveling. You just have to be a lot more cognizant of the things that we know already. And the things that we all know already is we really should try to avoid people that are sick, avoid touching your eyes, nose, and mouth. Stay home if you're sick, if you don't know what's wrong. It's ideal not to expose other people. Cover your cough with, and the arm thing, it's a little bit more updated. They try to get you to do a tissue and throw the tissue away and wash your hands because you've contaminated your arm too, but it's better than contaminating your hands and not washing them. Clean and disinfect frequently touched objects using regular household cleaning and sprays and wipes. The reason why I know that people think that coronavirus is new is because I have so many people come to me and saying, Clorox and Lysol already have that they kill coronavirus on their labels. They do kill coronaviruses, but it's coronavirus has been around with us for a while. And follow the CDC's recommendations for using a face mask. Right now, they're really not recommending, if you're well, to wear a face mask. And that's a really, to me, that's a hard concept. And the reason I think it's hard is because that's my immediate inclination, is for people to protect themselves with a mask. Right now, if you're not sick, you're potentially taking masks away from healthcare workers and for people caring for people that have it. And if we do get it in our community, we want to make sure that people that are close to it, because those are the highest risk groups that are going to get infected, are healthcare workers and people caring for the sick at home. So the CDC's recommendation is not to wear them right now if you're well. You have to think about there are other ways to get it, that a mask is not the only means of protection, and you shouldn't be comforted by wearing just a mask. You need to do hand hygiene, and you need to think about eye protection, because we think that that's a transmission mode as well. So that's why the mask issue is, to me, it's not it's a gray area to me and not black and white. Wash your hands off in soap and water for at least 20 seconds, especially after going to the bathroom, before eating, after blowing your nose, and doing any hygiene with your face. So if we look at our current travel advisories, these are the ones as of yesterday. There is widespread and sustained transmission and restriction on entry into the United States from China and Iran. It's really interesting to read about that happens. You've probably heard enough in the news that essentially patients that are visitor or United States citizens that are coming back are funneled to one of 11 or 12 portals of entry, screened, and if you are symptomatic, you are quarantined. And in some cases, even if you're not symptomatic, you're still quarantined if you're from a high-risk enough area. There's widespread transmission in South Korea and Italy, and we have sustained transmission in Japan and limited transmission in Hong Kong right now. And this is updating all the time, and so one of the things that we found out yesterday is that the CDC has not yet updated information for travelers anywhere but China yet. That information was updated on February 8th. So as you saw last night, we have our first case in Georgia that is a traveler from Italy. So we don't know really we don't have guidance yet on what we're supposed to do for the other countries. This is not up to date. I know it's not, but this is still what's on the CDC site this morning. As of yesterday, there were a total confirmed and presumptive positive cases of 43. I believe that number is really over 100 right now. We are seeing some person-to-person spread. Travel-related was, initially the lower number or the higher number, especially with travelers coming from the Diamond Princess. But now we're seeing more sustained community transmission. If you look at the numbers that we had at least yesterday that I know are not up to date, there was a total reported 43 cases, total hospitalized of 17, total deaths of 2. We know that's higher than that. At least in Seattle, we had 6 deaths alone yesterday. 4 of those deaths were from a nursing home that had a sustained outbreak of 23 or 4 healthcare workers and 25 residents. So we know that. We know that at least 4 of those patients were elderly with chronic medical conditions. So we expect this number to go higher. It's just not updated yet. And again, this was the initial, these are the people that are repatriated or brought back into the United States. Most of the cases were from the Diamond Princess cruise ship that were positive, and I know that number is higher now. This is not updated either, even though that's still the picture on the CDC's website this morning of the states that have positive cases. We know now that Georgia is part of that. The World Health Organization also has a really nice chart of how many confirmed cases we have worldwide. 90,000 cases worldwide, and you can have the countries, the top countries over on the left-hand side. And you can see, that month, that February 13th, I think that they had just a ton of new cases reported that time. There were 15,000 new cases reported on that day. This is information from last night with the 2 cases of coronavirus. One was a traveler from Italy who infected a person here. And then community considerations. I didn't want to go through a lot of this because there's a lot of data out there. There is guidance available for EMS and 911 right now, very specific information. There's information on the CDC site for pregnant women and children, from businesses on what to do to prepare to work from home. A lot of the information I gave you earlier on staying away from people that are sick and not going to work and all of this is all included in those recommendations as well, and information for schools. We don't, right now, without having a local case and a district case yet for our area, we aren't seeing a lot of school closures. We are seeing school and business closures, in Seattle and places that have ongoing transmission. For myself, in the hospital today, I talked to our telemedicine department to make sure that Dr. Matthew, who's the other infectious diseases doctor now, will have the availability to work with telemedicine because he and I are expecting to get sick. I mean, we are expecting to be able to try to work remotely. Some jobs can't do that, but we're trying to prepare, as Tim said. We just, prepare for the worst and hope for the best. So, do you want to do any questions now, Tim? Okay. Does anybody have any questions? Yes.
At what point would you say, gee, we need to close the schools? Would it be one case
That's
in
going to
each
come
school?
from public health.
Do they have a standard guideline? What is that? What
There's not a
percentage?
standard guideline. That'll be a state and district.
So you would wait to hear from someone else to tell
Yes.
us that we would need to close schools
Yes.
in Carroll County or public buildings?
Right. Yes.
My question may be more for Chief Paget, but I don't want to go, for instance, on social media. I've had a lot of calls that constituents that want to know what Carroll County is doing. I don't want to go and try to list the 19 ways that maybe the virus spread and so forth. But in general, do we have a hierarchy chart or something just to show? Obviously, the picture of the people in the room today shows that there's the masses here working for the people in Carroll County. But is there something more basic that we can give to the public that just outlines for Carroll County what we're doing, if we're on top of things?
Is that something, Kelly, is that something we can work together to do? If it's okay with everybody, I ask Kelly Meggs, who is their information officer,
for Tanner to maybe assist us with that. Therefore, we're putting out the same information
Right.
along with public health.
And this is going so fast. This is all so preliminary, even with our, we have pandemic plans for years, but this is going to be a little bit different. And we're just really working as fast as we can to work on planning. So I think it's all preliminary and we can do that. Okay. All right, good. Thank you.
Thank you, Dr. Larson. Now we have Dr. Bobby Mitchell. Dr. Mitchell is our medical director for Carroll County and for the city of Carrollton, Fire Rescue, 911, West Georgia Ambulance. So, Dr. Mitchell, if you don't mind.
I want to tell you something first about infectious disease people. They are extremely smart. The point behind that is that infectious disease is extremely complicated. It's not just this bug, you kill it with this medicine, and it's immensely complicated, and the people that are allowed into those residency training programs are extremely smart. And this, like so many of the other potential pandemics, is immensely complicated. And I think for those of us who kind of have to face the public, it's keeping people in perspective. This will be bad. There have been other bad things. This may be the worst, but the vast majority of people will come out fine. People my age and older, 65, will fare the worst. But everybody else will eventually mostly be okay. We have to be reasonable. We have to reassure the population. I'm an ER doctor. I'm a very garden variety ER doctor. But what we fear the most is this panic run to the emergency department, because we're kind of painted in the corner. We can't run away and we can't put up walls. And the biggest problem with the pandemic is that all the other stuff doesn't go away. They're still going to have heart attacks, they're still going to have strokes, they're going to have terrible car wrecks, and we've still got to take care of all of that, plus the panic. It's, if you remember, even with Cryptosporidium, Tim mentioned on that day, 300 people showed up at the college infirmary, and we got pretty much the same at the hospital emergency department. Well, you can't help anybody in those cases, and it's very, very important that those of you who speak to other groups kind of get the word out, that you don't, if you run to the hospital in the ER, that's the best place to catch it if you hadn't got it already. So we want to send that message out. Only place worse might be a church nursery, because everybody thinks they've got to go to church or they're going to go to hell. So get that sick baby in there. So that mentality is kind of what we fight. Big public places. I'm also medical director for Six Flags and Whitewater, and the message there is if it gets bad, we just close. Just everything shuts down. Where the city can't shut down, and certainly the hospital emergency department and the poor first responders, they're on the cutting edge. If there's one single case, a crew's going to be exposed to that. Probably first responders from fire, and then the crews from the ambulance service, and they're right in the face of it. And we have to emphasize to those people that the best place to put that mask is on the sick person, like Dr. Larson said, because the sick person, if you can block it here, that's better than trying to let it get out in the air and then I'm going to cover my safe. That's not as good. So if somebody's sick, the first thing you want to put the message out, put that protection on them, because that'll do the most good. So we're very fearful of a panic, but we're very hopeful for it in general. And my paramedics and the first responders on fire have right to be worried. They'll take proper precautions. They wear protective gear anyway, and that just has to be enforced rigidly, that you don't have to die for the cause. Just because you're going to go where the disease is, you do not have to sacrifice your life for others. And so that's the same with anybody else. That there are ways to protect ourselves, and we need to do that first, because if we start losing firefighters, paramedics, police, that's worse. That's worse. Then we can't protect the community from anything. So, again, I'm not an expert in this, but we are on it. The hospital officers will talk to it, but the emergency department has a plan already for what to do. When people come in with those symptoms, certainly if it's getting into Georgia, those people will go past triage back to a separate area, and they'll be quarantined there. I don't know anything about testing. I'm sure Deborah will know about that. But the medical community is on it. We're trying to get, like Laura Larson said, we're kind of feel behind. But there's really smart, unlike terrible things in the past, there's extremely smart, well-trained people in the community. Here we are in Carroll County, Georgia. You got an infectious disease specialist office. Those people are on it. They've been on it. I hear criticism for the CDC. For the San Antonio mayor, I think, was something. It's like, that's ludicrous. If you think there's not going to be stuff slip by, thank goodness for the CDC and the World Health Organization. They've been planning for this and everything that comes after it for years. And that's what we have to understand. We're going to be okay, and we have to make sure the community's okay. And our first responders and paramedics will protect them as best we can and still be available to the public. That's all I got.
Any questions for Dr. Mitchell? Gary, did you want to cover that about the man? Okay. Okay. Deborah Matthews is our executive nurse with Tanner. Deborah's been through a lot of disasters with us, and so Miss Deborah.
Thank you, Tim. I brought with me some notes from yesterday's meeting at Tanner about our preparation for this. So I just wanted to cover a few of these things with you, and we'll be happy to answer any questions that I can. First of all, we have been able to implement a screening process for all patients at their point of presentation, whether that be the hospital, the emergency room, any of our clinics, urgent care. So when a patient presents, there's a screening that's going to happen. That's the first thing. And we have a new electronic health record called Epic. And fortunately, this allows us to link directly to the CDC should the patient meet any of the screening criteria, and then it gives us specific guidelines on what to do for that situation. So we're very fortunate to have that in place. We also, this is what we do. So we have surge plans in place that we are dusting off. We have pandemic plans in place that we are dusting off. We have a team of people that I'm very fortunate to work with. Gary Thomas and his group in emergency management. They work very closely with Dr. Larson and Missy Robertson and their group in infection prevention. And then Kelly with information management. And then, of course, Carroll County, this is one thing that you can put out there, Clint, that we're very fortunate that everyone works together in Carroll County. So I think that's a very, very great asset that we have above a lot of other places, because we all pull together and we all work together. So very proud of that. With our supplies, we have supplies. We have a pandemic stash that we always have available, and we have months and months and months of supplies available to us. And I say months and months and months because that's going to depend on the severity of this and how much we have to use that. But we do have plenty of supplies. As far as our routine supplies and orders, we are on allocation allotments from our suppliers, as are all hospitals, and that's to keep people from ordering more and hoarding, but we are getting our normal shipments, our normal use supplies. So we're not having to dip into those emergency pandemic supplies at this point. As has been said before by Dr. Larson and Dr. Mitchell, we are expecting patients with chronic illnesses and the elderly to be the ones most affected and to be hospitalized. And I'm going to repeat it again, that we think our greatest challenge is going to be dealing with the people who think they need to be in the hospital, who need to stay home because they are not, that severely ill. And we have contingency plans in place for things like linens, foods, and you think, well, you should be able to get your linens, but what if the linen supplier has staff that are out? So a lot of contingency plans are in place, down to if we have staff out, which is always my greatest fear, and then we have contingency plans then for how, with low staffing levels, will we continue to take care of the patients that we have to take care of. So we have plans in place for that, providing the minimal and essential care to our patients, but still providing the care that they need. We have been communicating with our providers, and again are fortunate with technology that allows us to provide them with links to the current guidelines, and so that they're up to date at any moment. We have the ability to put out rapid cast on a moment's notice to all of our providers to provide any new information as well. We do have plans in the ED, as Dr. Mitchell said, to cohort these patients. We are working on those locations. We have that designated in Carrollton. It's a little more difficult in some of our smaller facilities, but we will be able to do that. Dr. Larson has worked with our lab on influenza testing to get that on a more timely, immediate response to that, because we want to rule out if it's regular flu, or if it's not regular flu, then we know we may be dealing with something else. So instead of batching tests a couple of times a day, they'll be doing all flu tests stat to get immediate results. We are also working with our Tanner Medical Group clinics through Susan Fox. They don't normally stock some of the supplies like N95 masks, so we're working to get those clinics supplied. We are prepared with our visitors if they need to use PPE, masks, and gloves and things like that. We're also prepared at a moment's notice to go on more restricted visitor regulations, or even, prohibiting visitors in certain cases there. Missy with IP and Kelly are working on updating all of our influenza signage that we have since it's flu season throughout the system to include information about coronavirus as well on that signage. We have been fortunate to have combined and have central bed control for every facility in our system, so that we have a group of clinical people that man that bed control. So if they're getting calls about patients that need to be admitted, they will know where our negative pressure rooms are in the system. They'll know where we're cohorting those patients and what the guidelines are and how to respond. We also have been providing additional information to our intensivist in ICU, and should we have patients with coronavirus, Dr. Larson, Dr. Camp, Dr. Matthew will be working hand in hand to guide those physicians in caring for those patients. And as of yesterday, it was a weekly meeting, and we had said that once coronavirus moves into Georgia, we'll move to daily, just 15-minute briefings. And so today, we're moving to daily meetings for updates internally. That's really all the information that I have. As I said, we have the surge plans, the pandemic plans, so we feel we're as prepared as we can be. And with the help of our community partners, we'll all get through this. Question?
How do you know you moved from a surge plan to a pandemic plan? What are the
It's essentially the same actions, maybe on a little larger scale with your pandemic. Yeah. And surge is something that we deal with frequently. For example, if we don't have enough beds for all of our patients, we have protocols and procedures to pull staff in to take care of patients in holding areas. So those same type things would be put in place. Yes, sir.
Are there any, this may be more of a question for the physicians, but any currently developed medicines to counteract it, or you just, drink water, treat your fever and cough?
That's a great question. Dr. Larson, do you want to take that one?
Medicine that's experimental
We don't have any data on it yet. There are some circulating information from China that different HIV medicines have been used, that Tamiflu has been tried. The problem is we just don't have any information as to whether or not any of that worked. I want to mention testing, because right now testing, you can't go to Tanner and get a coronavirus test. And a lot of well people want that. So what happens right now is if I have a patient that meets the criteria for testing, which are on the CDC's website as of February 27th, I contact public health. Public health arranges the testing. There is a presumptive kit, and then it's confirmed. Every test is right now is confirmed at CDC, and we're expecting the commercial labs to start producing tests for the public soon. One commercial lab did announce yesterday that they had tests. They're sending them mostly overseas right now. But to your point, if we have a severely ill patient, the state and CDC will be involved and will help direct our care with protocols and compassionate use. That happened to us actually with H1N1. We had some severely ill patients. I had a 26-year-old pregnant patient that I really thought was going to die. And we had a shipment of experimental drug within 4 hours to our hospital system. It's pretty remarkable. You don't know what that will be until you actually have to tap it. But right now there's only one drug that I'm aware of that's being published on the CDC site that is being talked about. There's a lot of information all over the internet on different things being tried.
It's a great question.
But nothing proven.
Dr. Larson also has meetings planned for tomorrow with our staff. She's going to make herself available at several times throughout the day for the staff to come by and ask questions and get information, because we want our staff to have information to protect themselves so that they can work to take care of our patients. Any other questions for me? Thank you.
Thank you. Any questions or comments so far? Okay, just a couple of things we talked about was we are updating our pandemic plan, and we will get with you all on that. Many of you have been involved in the past with that, and we will continue to do that. Something I wanted to talk to you about just real quick was something that public health has been working on, and I think we have a pretty good handle on it in Carroll with emergency management and public health. Is we've been updating our closed pods plans, and basically what that is, if you're a school or the county or whoever, and you have employees and you have family members, if we had to give mass meds or anything, we would carry that along with public health and the county folks. We'd carry that information to you along with the medical supplies, and you would distribute it within your agency or within your system there. And most of the larger businesses in town, Southwire, EMC, the university, the county, cities, are all involved in that. So we've been updating those pods plans, and I think the closed pods are going to be good. If something did happen, we always plan for the worst. If we had to do an open pod plan, which is a points of distribution, we have 2 sites that we would utilize. One of them is out at the University of West Georgia Stadium. And we have a traffic plan there where we can move the people through, give them their meds that the government would distribute, and then send them on their way. The other place would be the V-Plex in Villa Rica, same thing. And we'll dust off those plans and update those in the very near future. Any questions so far on what we've covered? Okay. Where do we go from here? What's y'all's thoughts on that? I'll tell you, in the past, what we done is we sent out emails. We worked with Tanner, had an email group that we basically sent out updates as new developments occurs, and that seemed to be the most, instead of just having a meeting all the time, because like Deborah said, you'd have meetings several times a week and everything else. But we'll do whatever y'all want to do to keep us safe. So kind of tell us if there's anything y'all want to do different.
Tim, I wonder if we should set up maybe a call where we could call in once a week as a group.
Okay.
Just get updates or share information. And if there's nothing going on, be a brief call.
Yeah. Is that something that we could do through y'all? Because I don't know if we actually have a good conference bridge.
We can do that.
Okay.
So Missy will work with you to
Okay.
set up.
So everybody was clear on that. Deborah brought up that we do a conference call. I don't think the county has a large enough conference bridge to bring us all in on that call. So we'll work with Tanner on that if that's okay with everyone. Okay. Any other questions or concerns or comments?
You want to talk about supplies?
Yes, sir.
Yesterday, the hospital started getting calls from some of our local community partners about PPE supplies. And Tanner is a member of the Georgia Department of Public Health Region C Healthcare Coalition. That coalition covers Bartow, Carroll, Chattooga, Coweta, Floyd, Harrelson, Hurd, and Polk. There is a stash of infectious disease supplies stored for the coalition. If you are a public safety agency, school, or skilled nursing facility, and you have specific needs for PPE, if you'll email that request to Tim, we will send that request then to the coalition, and they're going to compare that to the request throughout the coalition, and then we'll see what we can get distributed. So Tim's prepared to take your request. He'll send them to me and Janet Smith, and then we'll work with the coalition to see what we can get distributed. Any questions on that? We started getting those calls yesterday. Deborah mentioned that us and most of the public safety agencies are on allocation. We're getting our normal supply, what we normally would get, but we're not allowed to add anything to that. But the coalition has some in storage that they rotate out to keep it fresh. So we do have that stash available. Okay, thank you.
Any questions or concerns from anyone? If not, we have y'all all on the email group, and we'll send you some stuff out probably today on some preventive measures and making sure you're protected at home, making sure you have a disaster supply at home. And if there's nothing else, we stand adjourned, and thank y'all for coming.